Hi, I'm Jennifer Frazier, a scientist at the Exploratorium, and I'm honored today to introduce Dr. Kirsten Bibbins-Domingo, Vice Dean for Population Health and Health Equity at the University of California, San Francisco. Last Friday, Dr. Bibbins-Domingo and I pre-recorded a conversation on health disparities in the COVID-19 pandemic. Given the events of this past weekend, I reached out to Dr. Bibbins-Domingo to see if she'd like to make any additional comments on racism, police violence, and public health, and she said she would. Please join me in welcoming Dr. Kirsten Bibbins-Domingo.
Thank you, Jennifer. I really appreciate the opportunity to record an additional message. We spent a lot of time talking about disparities in COVID-19 and the public health response. There's so much about COVID-19 that tells us about the deep and pervasive inequities that exist in our society. And since the time we recorded that interview, those have become even more pointed. What I'd love your viewers and your listeners to really think about are two numbers that really stick with me. The first is 1 in 1,000. And 1 in 1,000 is the lifetime risk of a Black man in the US being shot by police, being shot and killed by police. That's a very high number. If you look at young African-American men, being shot by police is amongst the leading causes of death in the community. So what we're seeing today, what we're seeing on the protests is really, it is about a specific killing that's happened that really has triggered this, but it sits against a backdrop of all of these numbers. And so there are many in the public health community who've said if we are going to be concerned about causes of death in these communities, we have to call out police violence as a cause of death and one that we have to work to try to mitigate. The second number that I want you to talk about, and we talked so much about many of the inequities, but I want your listeners to focus on this number, 1 in 2,000. 1 in 2,000 is how many African Americans have died of COVID-19. So over the last 3 months, we have seen 1 in 2,000 African Americans dead. So this pandemic, this infection, this virus affects all of us, but it does not affect all of us equally. And we know that this large burden in African American communities runs along the inequities we see in society. It means that within a city, not all neighborhoods affected equally. When we look at nursing homes, which are really the source of much of the deaths for COVID-19 in this country, it's even striking. The New York Times has reported that nursing homes that have a higher proportion of Black and Latinx residents have the highest rates of coronavirus infections compared to other nursing homes. And if you look at other places where outbreaks are, in the prisons and jails, and in low meat processing and food processing plants, those are also areas that are mostly low wage, minority workforce. So when we think about inequities, the challenge for us, and what I would love your listeners to think to, is that these issues are complex, and the burden in African American communities relates to police violence, relates to COVID-19, and relates to the deep structural inequities that exist in this country. And we as a society have to think about all of those things together when we think about how to tackle these issues and how do we make all of our communities healthy. Right now, what we're seeing is protests, and protests is a long tradition in the US. It's something we're very proud of in the US. And I think it's important for people to understand that these protests reflect these numbers that we're seeing. And that for those of us who, as scientists, live by our numbers and live to understand what forces influence health, it's incumbent that we think in our many ways about how we work to understand these numbers and what we can do to keep people healthy. And then one more thing I would want your listeners to really understand is what we absolutely cannot do at this point is allow our concern about public health for COVID-19 to somehow be used to suppress the types of protests that are actually happening, because these protests stem from this long-standing and deeply seated structural racism that exists. Protesting outside is, as we talk about in our interview, being outside is probably something that lowers your risk of COVID-19 transmission. People who are outside protesting can wear a mask. That's another thing that's going to be really important to do. There are steps that people who are protesting outside can take to lower their risk. There are also steps that the police should be taking as well to lower risk. And I think many public health organizations are issuing statements to talk about both. But using public health and concern for COVID-19 to suppress people's ability to protest is not a reasonable option at this point, because one of the things that is going to be incumbent on all of us to think about as we go forward is how we figure out both to reconcile what has happened in the past, but also to rebuild trust, because public health ultimately relies on trust between those who are thinking about how to use science to protect the public and the communities we seek to protect. And it's those that rebuilding of trust is something that's going to happen, whether we're thinking about the public health issues of police violence, the public health issue of structural racism, or the public health issue of COVID-19.
Wow. Thank you so much for making these additional comments and just for all of your research, advocacy, and even this continued public outreach to engage with communities and help them really understand these complex issues. We want you to know that we stand with you, and we hope that this program today raises awareness about the intersection between racism and health, which can't be ignored during this crisis. So I now invite everyone to please continue to watch the conversation that Dr. Bibbins-Domingo and I recorded on COVID-19, but keep all these larger issues in mind. Thank you and be well.
Thank you.
Hi, everyone. I'm Jennifer Frazier, a scientist at the Exploratorium. Thank you for joining me for today's COVID conversation, our series where your questions guide our interviews with the leading doctors and scientists working on COVID-19. Today, I'm incredibly honored to introduce Dr. Kirsten Bibbins-Domingo. Dr. Bibbins-Domingo is a professor and chair of the Department of Epidemiology and Biostatistics at the University of California, San Francisco. She is the Vice Dean of Population Health and Health Equity and co-founder of the Center for Vulnerable Populations. Dr. Bibbins-Domingo is an international leader in research on health disparities and is here to talk with us today about the disparities that are already emerging in the COVID-19 pandemic. Please join me in giving a very warm welcome to Dr. Bibbins-Domingo. Welcome.
Thank you very much for having me. I love the Exploratorium, and I'm glad that you invited me. Thrilled to be here.
Oh, well, the Exploratorium loves you and can't wait to have you back soon. And I'm just glad that you could join us virtually today. Thank you so much for being here.
Absolutely.
All right. And we are, this is such a critical topic. We're going to jump right in. And I think to start off, in the US, we're already seeing African-American, Latinx, and other underrepresented populations overrepresented in cases and deaths of COVID-19. So can you just give us an overview of the data that's coming in?
Sure. Some of the numbers are pretty striking. The areas of the country that have had the highest rates of coronavirus infection have been Navajo Nation, for example. So extremely high, higher than New York and New Jersey, which are the places we oftentimes think about. If you look at deaths from COVID-19, a quarter of the deaths in the country have been in African Americans, even though they represent about 13% of the population. And then when you drill down more locally, if you look here in San Francisco, the cases of COVID-19 are really predominantly in our Latinx communities. And that's true across the state of California as well. So I think what we're seeing is that although the virus can affect all of us, and we're certainly all affected by this pandemic, the impact is really not felt equally in all communities. And I think that's an important to understand when we look at the pandemic, and it's going to be important when we think about how to respond.
I think the real question for a lot of people, we're seeing this kind of news coming in about the Navajo Nation here in the Bay Area about the Latinx community. And the question emerges, why are we
Right.
seeing these, disturbing trends? And as someone who has been working on health disparities for a long time, have you been surprised?
Yeah, I would like to say that I've been surprised, but not really. I think all of us who study inequities in health were really bracing. The data was a little bit hard to emerge because we don't oftentimes collect the data in the right way. The data is sometimes slow to emerge, but when it emerged, it clearly followed the pattern that we expected to see. It's the pattern that we've seen in prior pandemics, and it's the pattern that we see just in health states in general. So I think what the pandemic exposes is the deep and pervasive disparities that we have in health anyway.
Well,
Why does this
yeah.
happen? And I think that, we can think about the categories. It's easy to think about them, but I might just tease them out for some people who it might not be readily apparent. So
Yes.
you and I are working from home. We have the luxury of telecommuting, and part of our ability to telecommute depends on other people who are out working, right? So there are other people who are making food, who are delivering food, who are delivering other types of things, who are keeping our streets safe, who are keeping our hospitals clean. And those essential workforce is a low wage workforce. Oftentimes it's a workforce that's disproportionately represented by communities of color. We know, so there's a higher likelihood of just being exposed to the virus, it turns out. We know that there are other health states that make you susceptible to severe disease. So people who have high blood pressure, who have heart disease, those things make you more likely to have severe disease or die. And those types of conditions run more deeply in many of our poor and minority communities. And then there's issues of healthcare access. So it's hard to get tested. You sort of have to have insurance right now to get tested. Not anymore, but that was probably true at the beginning. So there's, and there are many ways in which we've heard stories around the country just of ways in which sort of biases emerged in how people had access to treatments, had access to tests, which probably had an impact as well. And the challenging thing for health disparities is it's never one of these things. They all sort of weave together. And one of the things that's been pretty striking for me is and sometimes we don't realize it as much in our privileged positions, but it actually takes resources to stay sheltered in place. It takes resources to be quarantined. And so when I say this to my patients who I see at Zuckerberg San Francisco General, and I realize that they are living with several other people in their household, that they have to go out to get food for their family, you realize that even the basic things that we are asking people to do to stay safe in this pandemic are much harder for the communities we're talking about.
Well, and so if I just sort of think about some of the things that you just said, it sounds like some of it is basic exposure, right? That like one of the reasons these communities are being affected is they either due to their work or, lack of other resources for like delivery or something, they are having to be out there being exposed to the virus. Some of it has to do with underlying health states, like maybe that already due to some other circumstances, maybe there already were predispositions, which we know can affect you with the virus. And then you're also saying there's an access issue, like maybe not having access to good healthcare, not getting access to testing. So I'm sure those are only three of many factors, but are those sort of the three biggest things you're thinking: exposure, underlying conditions, and access?
Yeah, I think those are the three big buckets that we would put it in. And then I think right now those are the three big buckets, and I think it's helpful to think about those as the big buckets to put things in. I think what's harder sometimes to appreciate is how these things intersect, right? So even a simple thing like many of your listeners may not know, but about half of the deaths in California are nursing home deaths. So those are deaths that are taking place because people are living in we call them congregate living settings. So people living together in the same setting. It's much harder to control virus spread, right? So when the virus enters into a place where lots of people live together, it spreads much more quickly through that place. And that's one of the reasons why nursing homes are a challenge. People with more health conditions are living in nursing homes. When the virus gets in, it's more likely to spread. That means we, as in public health, have to pay attention to nursing homes. It's why in San Francisco, we are testing regularly nursing homes, people who work there, people who live there, even if they don't have symptoms. We're testing more regularly because we know it's such a risk. But one of the things that was striking when they took the national data was it was nursing homes that have a higher proportion of Black and Latino residents that have the most deaths. So you see how these two factors then come together, and it reminds you that that we really have to have the data to help us drive, and it also reminds you that inequities that exist in society oftentimes exacerbate the things that we're talking about.
Well, you've brought up, I mean, that helps clarify a lot. And you've mentioned in two of your answers the importance of data, right? Like having the data both about like which populations are being affected, and then even with this nursing home example, that you could just categorically talk about nursing homes, but if you drill down into the data, you see that it's affecting different communities more dramatically. So, I mean, I know that you've also worked on a health atlas with UCSF, and I think those who are at all associated with healthcare are familiar with kind of like your zip code can sometimes matter more than your genetic code. Is that one of the reasons that do you think that data collection has to play a huge role in addressing these health disparities?
Yeah, I think data collection absolutely has to play an important role. So you mentioned the Health Atlas. The Health Atlas allows us to put together data about COVID-19 with data about other things that we know affect health. So we know in our neighborhoods, whether I live next to Golden Gate Park, whether we live near a place that it's safe and easy to exercise is one of the things that's going to influence my health. Other neighborhoods don't have that type of access, or the outdoor spaces may not be safe spaces because there's more crime, other things in those neighborhoods. So being able to juxtapose health data with what we sometimes call these social determinants of health in the same place, which is what we're doing with the maps and the Health Atlas, I think can help people see things that are happening. Right now in California, at the southern part of our state, Imperial County still has the highest rates of COVID-19, really shockingly high, double the rates even than LA.
Oh, wow.
And that's a county that has a high rate of unemployment, has a high rate of pre-existing lung disease, a high Latinx population. And you can see how many of the things are going to make it challenging. We need to focus our public health efforts there, but it will also be challenging because of the other things that we talk about. And so I really think that data is going to help us target our public health efforts more effectively, which is going to be so critical in this environment where we're all trying to get the pandemic under control.
Well, and that I think it's both the pandemic. You've highlighted that these issues were there before the pandemic. The pandemic is highlighting a lot of the issues and have laid out some of the reasons why, right? Like pre-existing conditions or access to, healthy exercise. So what are institutions like UCSF or other leading institutions, researchers like you, what is it that you're looking at as solutions for some of these issues, and what are some of the challenges to addressing them?
Yeah, well, I'm a professor at UCSF. I'm a physician there and a researcher, and I'm really proud of UCSF, obviously, because I think because I think that I think the pandemic has really brought out the best in what we do at UCSF. So please forgive the commercial, but I'm going to just tell you a little bit about that.
I'm alumni too, so I really love UCSF. It's a fantastic public university.
It is. I think UCSF leads with the things that are core to our mission. We provide clinical care, we educate, and we do research, right? So those are the three primary things. And because we're also a public institution, we want to do that with the goal of serving the public, right? And so what I love, our clinical colleagues really prepared everything for the surge that we hoped we were not going to see, but we were ready for. We did a fantastic job. And as soon as it was clear that because of everyone else staying at home like you all did, and that we flattened the curve in our area, and then the number of people who just volunteered to say, we have to go to New York, we have to go to Navajo Nation, that's what we need to be doing. It was really quite inspiring, and I think we sent teams to both places. And it was really important, and I think the numbers who volunteered was far in excess of the numbers who actually went. And so it really was a testimony to us leading. We provide care, but we're going to also provide care where care is actually needed. So that's one example on the care side.
Targeting. You're saying targeting. I mean, just to like on solutions. I think you mentioned this with the testing, and you've mentioned it with like, is that it's about not just like, oh, let's do something broadly, but are you saying that targeting things to communities in need, like targeting the testing, health interventions, public health messaging? That's one of the key strategies for addressing some of these disparities.
Yeah, that's exactly right. We've actually had a long-standing relationship with Navajo Nation, for example, and so clearly there was we all heard on the news about the need in New York, so that was clear. But the very next thing was that we sent the teams right away to Navajo Nation as well, and I think just the comments back from what our nurses and health professionals saw there, but also from the comments from the president of Navajo Nation, comments back, I think really struck home that it's really important to go where the need is the greatest, and we can actually do something to help alleviate. In this case, because they needed real people to staff the ICUs because of the high burden there. With education, we've been similarly trying to do it. So I think here now of like our Latinx Center of Excellence. They've been really taking education to the community-based organizations in the mission, in other Latinx populations, really working with the community-based organizations to get information out in Spanish. They have a team that's been working the food lines in the mission, actually, to give out masks and other types of things. Because even masks, I don't know where you have been ordering your masks from, but even those are hard to get sometimes. And so they've been out there both educating on public health practices, but also, taking it directly there. And then even things like research, we've had outstanding scientists who are doing clinical trials. Our basic scientists are phenomenal and are really working at the forefront of this. But I love them. You had Joe DeRisi on last week.
Great.
Joe and I were communicating just this morning because this weekend we will be doing a big study in the southeast portion of the city, in Bayview, Sunnydale, and Visitation Valley. We'll be there Sunday and Monday in the middle of the week, and then at the end of the week, the following weekend, we will be in the same area in Bayview, but focused on the unhoused populations. And there, just as we did in the mission, we want to really understand in these communities that have been most affected, what are the rates? How many people are asymptomatic? What else can we learn about risk factors in those communities? And we couldn't do this type of work, which is really epidemiology, without Joe's help, for example, because he has really had the testing labs and the facilities up to have that running. And so what I love at UCSF is that we've actually worked a lot together, and I think it's brought us as a UCSF community together to do this type of work. And I think we are leading with where we see the need the greatest, but we're doing it in partnership within our groups at UCSF, but then also most importantly in partnership with the community. So we couldn't have done this study in the mission first and in the Bayview and Sunnydale and Visitation Valley really without strong partnerships with community organizations.
Well, so it sounds like, if we have these health disparities, which have already existed, we see them coming to light in the pandemic. And then it sounds like leading health institutions like UCSF, it's a combination of collecting the appropriate data, working across sectors, right? You can't just have a doctor. You also need like people who can run the tests and do a lot of the analysis or basic research. And another component, it sounds like, you've brought up that does always seem really critical is working with the community, having the community's trust, knowing how to communicate with that community. So it sounds like, are those elements that you think are part of like a solution, not just for COVID-19, but longer term addressing health disparities?
Yeah, I couldn't agree more. I would highlight two big elements. So we're really in the middle now of what I call a twin epidemic. We have the epidemic of the virus, but we're also starting to see the epidemic of a financial crisis, an economic crisis, right? And so again, just like both of those affect all of us in some way, we all know people who've been affected by both of those. They're also not going to affect all communities equally. And one of the things that we need to think about then is how our solutions really also address some of the economic issues as well, and the social determinants issues. And so it's been critically important to partner with the community-based organizations, because what we're doing in the southeast portion of the city is not just testing. We're testing and doing complete wraparound community wellness for people who have tested positive, right? And that response has involved the on-the-ground community organizations, the community who know how to get food to people in need. We are not trying to do that ourselves. We want to be empowering and enabling the community-based organizations to actually provide those services. They know how to do it. And giving the resources to them to be able to do that is the most appropriate and effective way to do that. So one is just about the economics of it, and understanding that we all have to work together across multiple sectors and to put resources in those communities themselves, so that these multi-pronged problems are addressed appropriately. The other is that we always worry a little bit about stigma, right? And so we're talking about health disparities, and we're talking in this very nuanced way about these multiple inequities. But what I don't want anyone to take away is, oh, all Latinx people have COVID, so I need to stay away and not hire them. Or that would be the worst thing to take away, because everyone can get this virus. And these are people who, because we have the luxury to stay home, and many are out working, that is what's putting them at risk. And so, but working with community organizations, I think, has helped us to figure out how to do the messaging to get the word out in a way that hopefully is less stigmatizing and empowers those communities also to advocate for the resources they need.
Well, I mean, so you've touched on a lot of solutions, and then this really critical point I think that everyone needs to take to heart, which is we're all equally susceptible to the virus. And so it's really important not to take some of this data, right? We want to use this data to like address health disparities and make sure that everyone's healthy. We do not want to use it to stigmatize people. And so just having that awareness, I think, is really, really critical. And, you know, you're talking about a lot of things that I think everyone is so grateful is being done, right? The high level things like, oh, research is being done, working with community organizations. But I think what a lot of people are wondering is, what could possibly be the role for an individual? If an individual is really disturbed by these health disparity issues, is there any individual action that a person can take to help address these disparities, instead of it being kind of this more abstract, something happening at UCSF, something happening in government? What is it that an individual might be able to do?
Yeah, it's a great point, and there's the needs are really great right now, and so what I love is the way in which people have stepped forward with either their particular areas of passion or their skill sets to do this. And so right now, one of the things that I worry about is there's a great need for food in many of these communities, right? And so as people have lost jobs, if people that really basic needs are not being met, and because that feels so immediate to me, if I wanted to think where somebody wanted to put either their volunteer efforts or their financial resources, I think that's going to be an ongoing need for many, and we have many great nonprofits that are working to do that. I think some of the solutions are going to be very local, so I would always urge people to think in their own communities who's the most vulnerable, because sometimes we can understand the pandemic a little bit more about the businesses in our own communities, the older folks at home in our own communities, and to think about how we really think about what we can do at a very local level. And then I think for some of these things, because of the economic crisis, many people have the ability to think about this from what they would do in terms of hiring or providing sort of job skills or investing in the community-based organizations within other communities in our city that might be most heavily affected, to make sure that we patronize those businesses or enable people who are providing services to unhoused populations or people experiencing homelessness that we give there. There's oftentimes a paralysis in this type of situation. It feels overwhelming. But I think that if people focus on the need is so great that no one person is going to solve this problem. I think people should focus on the thing that they feel most passionate about. That they should understand that if you just go to the San Francisco Department of Public Health, you can see the zip codes that are most highly affected. Think about how you might want to invest either in food and shelter or in the businesses that are there. And I think those are all wonderful ways people can get involved.
Well, I really appreciate that you're saying that, because I think that is the thing. It's easy to become paralyzed, and also to think that maybe when there are these huge issues, you as an individual can't do something. And you just gave some great examples that if someone, is still employed, even if in their office at home, if you still have resources, really meeting fundamental needs, like can you find ways to employ people in those communities who maybe have lost their jobs? Can you find ways to provide food or shelter? Can you find ways to patronize the businesses in those communities? Those sound like really actionable things that each of us can do to support those communities, even if we can't immediately address some of these larger issues. So thank you for sharing those, because I think people really are looking to address some of these issues. And I guess, I feel like I'm so grateful for the work you're doing. You're saying all these great things that are happening at UCSF, and I feel like we're really lucky to have someone with your leadership and research experience addressing some of these big challenges. I was wondering if from some of these larger issues, we get a lot of questions that are very, very practical. And in being a leading researcher on health disparities, you're also the chief of epidemiology. So
yeah,
it's like rather than being in kind of thinking about some of these really critical issues, I guess everyone feels like there are a lot of critical issues even around our everyday actions. Absolutely. Can I ask you a few questions we've gotten?
Of course.
All right. Now it's now you can put on your hat as a general epidemiologist. The thing I think we get the most questions about right now are masks, because I think, especially in the last few weeks, it's become really clear, masks are required. It seems like masks are incredibly critical for preventing spread, but there's still confusion. And I think one of the things that people are the most confused about is masks versus social distance, especially outside. So, I'm outside with a friend, with a family member, we're 6 feet apart. Do we still need a mask? What if you're outside, do you still need a mask when you're 6 feet apart from someone?
Yeah, good. So great question. So here's the first thing that I want to say. We all want to get out of this shelter in place. I don't know if you're like me, but no. I'm a little bit tired of it, right?
Oh, just a little, just a smidge.
Just a little, right? So we want to get out of shelter in place. That's the first thing. And the second thing is this is what my chancellor says, Sam Hawgood. He says, we're moving into a period of coexistence with the virus. So the pandemic is not over. But we have got to move into, we have to return back to life so that we can live our lives, and we have to do it in a coexistence with the virus. So coexistence with the virus, for me, means some things just have to be a normal part of our everyday life. And that is what masking is. So yes, The masking, we have to get in the habit that we are going to just be wearing the mask almost all the time, right? The
Okay.
mask is to protect you from me, right?
Okay. Well,
That's what the mask is for, right? It's to protect you from me. It does. But the point is that when we all wear the mask, we all protect each other.
right.
And I think we have to think about how we all want to get back to doing the things we want to do. And that's going to mean most of the time we're going to be wearing a mask. The mask really is done in combination with the social distance, right? The social distance just means that you and I are going to still keep a respectful distance from each other, even though we're wearing these masks. And that's how we keep each other the most safe. I will tell you, I work as a doctor in the clinic. We do in the clinic, while we're providing care amongst our doctors, we both mask and socially distance.
Wow.
Right? That's what we do. That's what I do. These are my colleagues that I see every week when I do my clinic. We do exactly that.
Okay.
And so,
yeah. Even outside though, because I think that's the question we're getting a lot is I think people understand that a lot of people are even afraid to be inside with other people. Okay. So they know about masks, but I think as the weather's turning warmer and people are going outside, I think they think distance is a substitute for masking. But even if you're outside, do you need to wear a mask?
Yeah. So again, why I prefaced it with we should be in the habit of wearing masks all the time is because we should be in the habit of wearing masks all the time. Now, if you're outside and you're next to your partner and and there's no one else around, you're probably in the safest possible environment, right? But for me, when I go outside, can I guarantee I'm always going to be 6 feet away? No. That's why we keep both of those things together. Because when people say outside, they're talking about very different types of environments. If you're walking with your partner when nobody else is around, and you want to, yes, that's probably fine. But most of the time when I'm in the city, there are other people around. And that is why I both try to stay distanced and keep my mask on all the time.
Right. And even if you're like having a picnic, I think, again, if we're making these baby steps toward sanity, even if we know that I like the phrase coexistence with a virus. So if, let's say I'm letting my teenager, she's going to be mad at me for asking specific questions about her. Okay. General teen X, unrelated to me, is going to hang out with her friends outside. They still should be wearing masks 6 feet apart. If we're having picnics, even if we're 6 feet apart, we should still be wearing masks. Just get in the habit of masking all the time. Is that kind of the mentality we have to get in?
I think that's what the mentality we want to be in. Now, if she's mostly hanging out with her friends, that's fine. If one thing I love, I read a really great article recently about Japan, right? So Japan never really went on a big shutdown, but they mask all the time. They mask all the time. And their message for the things you really need to be careful of they have a 3 C's of what you want to avoid: crowded spaces, closed spaces, and close contact spaces. And I thought those were really practical when you think about, okay, none of this is about 100% risk or 0 risk. It's like, how can I not put myself in a really, really risky position? Really, really risky is close contact with somebody who you don't know, not somebody you're normally living with.
Right.
Being in enclosed spaces, those are more dangerous than being outside, and crowded spaces, right? So when you give me the example of your teenager who's with her 3 friends she's always hanging out with, and they're outdoors and it's really just them, if their masks were off, they're probably at still low risk, right? But it's when they've all brought their other friends and there are more people around, then you can't get in the mode of saying, well, just because we're outdoors, it's all fine, because you don't know as much about the people who are around you. All of those things are what increase risk.
So it's weighing. In some ways, it sounds like what we all have to start getting used to. I mean, it sounds like in general, just get in the habit of wearing a mask, thinking of these things about weighing the different risks. Am I indoors? do I know these people and do I see them regularly? Oh, or are there a lot of people or a few people, like sort of balancing out the different factors so that you can make some judgments about like how safe you are or not, while understanding, that you do need to like edge back out into the world. But I like your way of framing it as kind of weighing some of these different factors so that you can make the best possible decision and still see the people that you care about. But it does sound like so here's another like question we've actually gotten quite a bit. It's about wearing these masks. I know because I was like, I actually can't even think of a good answer for this one. It's how, so now we're at our barbecue, we're at our picnic. Oh, restaurants are opening back up, but we're supposed to be wearing masks all the time.
Yeah.
How do you get the food? How do you eat at a picnic with a mask on? Or do you just sit 6 feet apart? Like how does this?
I know the restaurants, this is why I try to patronize all my favorite restaurants with takeout, but I have to say that eating in the restaurant sounds super challenging to me.
Yeah.
So I think, so just taking those same principles, I think many people are interested in how we move to more restaurants that have outdoor seating, right? Because we know that more ventilation, more air, that sort of reduces our risk. Certainly the distancing is going to be critical. And I saw these great pictures, again, maybe in Japan, where they actually put big stuffed animals in every other seat. So you couldn't actually sit any closer, right? So the social distancing is going to be critical in those environments. But I have to say, it's still a little nerve-wracking to think about restaurants because by definition you're there with lots of people you don't know. And as you say, you have to take off your masks.
Yeah.
Important to know that you don't get coronavirus from the food or from eating the food. It's not that. It's that if you try to imagine your favorite restaurant, you have to imagine really, while the mask is off, really making sure that 6 feet is there. And that's hard. And then, every time I try to think this out in my mind, I think about, if I had to use the restroom in the restaurant, and that feels all of a sudden like a more enclosed space where more potential close contact and one where you really don't know. And that, all of that makes me nervous. And I think it'll be a little while before I'll be able to do that. And I think the things that will give me more comfort are the other environments you're talking about, like the open air picnic that I do with people that I know, or
No, so that sounds, that helps. So it's like wearing masks, considering different risk factors, being out. If you are going to have a picnic or something, it sounds like you can't eat through a mask. And so you're maybe the distance and outdoors. And you started to touch on, I think my last sort of practical question from the audience, the Exploratorium audience, a lot of people have been shifting toward focusing on summer. And obviously like this summer is going to be very unusual. And there are a lot of very practical questions that touch on things you just mentioned, like, can I go camping? Well, if I'm camping, can I use the bathroom? Can I travel? Can I leave the county? There are many, many questions about summer. And instead of trying to go through all of them, because you have obviously a lot of work to do gearing up for this weekend with your study, what do you think or advise around safe recreation or leisure for this summer? Like, what do you think people can use as guiding principles for how they might be planning any kind of ways to like stay sane and bring some happiness to their life?
Yeah. One thing I want to get in before I launch in those is to just mention that one of the ways we can also keep all of ourselves safe is that if we're at all worried about any symptoms, to go get tested, right? And I want to bring that up because one of the things I heard this morning from some of our physicians who've been studying the data across UCs is that people oftentimes wait 3 or 4 days before they get tested. And if all of us were in the position that whoever did have a symptom thought to get tested and realized that right away, we would all do all of those around us a much better service, right? Because
Okay.
then so that's an important thing. I just want to plant that seed.
Get tested.
Yeah. So so yes, what are we
Okay.
going to do this summer? We all do need a summer break because the last 3 months have been very stressful. I think that those vacations are going to be probably with people we know. They will be more in outdoor environments than not. And we're going to have to pay attention to the data as it emerges about where outbreaks are starting to happen. Right now, we're in a really good spot in California. We're in a really good spot in a lot of the countries, but we know it's expected that as we open up, we're going to start to see little flares of
Right.
outbreaks. And so I think people are going to have to pay close attention to the environments they're in. They're going to start having to, you can enjoy a lot more with people you don't know when you have that mask on, which I know is not fun, but you
Yeah.
will be able to be in many more places if you think of the things you're doing personally and environments where people are also doing those. And then, I think with avoiding the closed spaces, the close contact, and the crowds, those will be the principles whereby people will then decide how they, the types of level of risk that they want to undertake in order to get some relaxation.
Well, it sounds like, so it's sort of the guiding principles, both, just in our, okay, your kids are done with their online school and maybe you can take part of the afternoon off, whether it's your afternoon or your summer. It sounds like just these guiding principles of wearing a mask, being aware of crowds, avoiding close contact, and then also, again, this theme of data. I think all of us knowing, like, if you are planning a camping trip, maybe look up that county's COVID-19 rate, and maybe they even have a shelter in place order there, and maybe you're not even allowed to go there. So just being able to plan and prepare by also looking at the data sounds like it's another important aspect of possibly planning your summer.
Yeah, I think that's right. I mean, we have to do all of this to keep each other safe, right? And I think the more awareness we can all have to help each other do this, that's the only way we're going to be able to do that. It's interesting when you look at some of the data in rural counties, they actually early on had more cases because people traveled to those counties for vacation or for ski trips or whatever and brought COVID there. So this is one of those things where we can't expect that somebody else is going to do it. We have to do it. We have to call ahead to the places we're going to go to find out, like, what are they doing? And we have to all be in this together. And that's the only way we're going to keep each other safe. There's no magical escaping. We're all coexisting with this, and we all have to keep each other safe.
Well, and that's, I think, sort of this awareness piece is sort of the perfect end, even though I don't want to end. And I'm already like, maybe the next time we have you for the show, we can be masked in a nice park somewhere.
Yeah.
With, like, a camera. But no, I mean, I think this awareness piece, one of the reasons we're doing the show is to help reach as many people as we can with the science as it evolves. And for you today, taking the time to share with us this critical work on health disparities and share what we can be doing to support every community, and also what we can do to support each other during this hard time.
Yes.
Like that, I thank you for helping raise awareness about issues and also, like, public health best practices, because I think it's just this moving target, so much data coming in, and having someone with your expertise help all of us is so incredibly valuable. So thank you for taking the time.
Not at all. Thank
Weekend.
you.
This weekend,
Yes.
It sounds like you've got a big project with Joe.
We do. Exactly. Exactly.
Oh, thank you so much, Dr. Bibbins-Domingo. I really enjoyed talking with you. I know everyone will enjoy hearing this, and I look forward to seeing you in person.
Exactly. Thank you all. I appreciate that.
All right. Thank you so much.
Bye.